Hello and welcome to this introductory presentation about MO1010 diabetes and its sequelae. This module provides you with the opportunity to extend your knowledge of diabetes, its management and subsequent common complications across the life course with a focus upon type 2 diabetes. Diabetes in the rural and remote context is explored by developing an understanding of prevalence, risk and prevention in conjunction with building assessment and intervention skills, including complications related to diabetes. The importance of the multidisciplinary diabetes team and complexities of delivering evidence-based care in rural and remote communities will also be explored. The intended learning outcome for this module is that you'll be able to combine advanced knowledge of diabetes and its sequelae and assessment and clinical reasoning skills to formulate and communicate care plans designed to optimise care in the rural and remote setting in accordance with best practice guidelines and local service strategic intent. This module goes for 6 weeks with 22 hours expected workload. You can see the weekly topics here. In week 1, Introduction to Diabetes in the Rural and Remote Context, you'll identify a client for assessment item 1 and gain their consent to partake in the assessment before accessing and familiarising yourself with the relevant clinical information. You'll gain an overview of diabetes before learning about its prevalence, risk factors and prevention strategies, taking part in quizzes to test your knowledge as you go. You'll also identify and make contact with at least one health professional, different to your own, who works with clients who have type 2 diabetes in your local area and ask if they'd be willing to discuss screening, assessment and intervention in the coming weeks. In week 2, Diabetes and its management, you'll learn about the pathophysiology, symptoms, presentation, diagnosis and assessment of diabetes, the goals of diabetes management, the diabetes annual cycle of care and health professional involvement in the multidisciplinary team. Finally, you'll consider self-management through the lens of client-centred care before submitting the first 2 weeks of your module workbook to gain feedback on how you are going so far. In week 3, Complications of Diabetes and Life Stages, you'll familiarise yourself with common complications of diabetes, diabetic foot ulceration, and psychosocial care of clients with diabetes before exploring the link between diabetes and disability. You will consider diabetes in the context of the older adult and end-of-life care before summarising your client's diabetes complications. In week 4, Assessment, you'll locate assessment and intervention evidence for your client's condition from the perspective of multiple professions. You'll closely review screening and assessment options and make contact with the health professional you identified in week 1 to just discuss screening and assessments from their professional perspective before preparing for and conducting an assessment with your client. In week 5, Interventions, you'll review the interventions relevant to your client using the evidence sourced earlier before making contact with the health professional you identified in week 1 to discuss interventions from their professional perspective. You'll also identify services relevant to your context and client, and discuss your learning to date with your supervisor, and draft a care plan for your client. In week 6, Variation, you'll compare your care plan with evidence-based guidelines before troubleshooting the complexity of delivering evidence-based healthcare. You'll discuss your care plan with your work-based supervisor for the final time before submitting assessment item 1. A single assessment task is due at the end of the module in week 6. The task is a written care plan for a consumer with a diagnosis of type 2 diabetes and a subsequent complication. You will also have the opportunity to submit a formative piece of work at the end of week 2. This is your module workbook, which is not marked but will give you some feedback on how you are going. We've built in some opportunities for you to interact with the content, the module coordinator and other participants who are taking the module at the same time. There are learning activities which include contributing to online discussions. This provides a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all details of assessment task and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns, and enjoy the module.